Welcome to the second tutorial video for the vascular simulation program. Vascular anastomosis is another important skill to learn. There are several techniques and conduits which may be used. We will cover the parachute technique in more detail during the next video. This will take you through a basic end-to-side anastomosis. Remember, when using a graft, the heel and toe refer to either end, supposedly because it looks like a shoe. For this task, you will need your artery and vein models as shown here. Before you start, have another look at the checklist and global rating scale in the assessment matrix. You begin from the point where the artery and vein are dissected from the surrounding tissue with proximal and distal control applied. Steady the artery with your forceps and make a stab incision using an 11 blade. Extend this with scissors. Next, shape your graft so it is the right length for your arteriotomy. Be aware that this is easier to do with curved scissors. The graft should sit comfortably over the entire length of the arteriotomy. Place an anchoring stitch through the heel of the graft outside to in, and then through the arterial wall from inside to out. Slide the graft into position. Make sure you snug each knot securely. Pass one suture beneath the graft and place in a rubber shod. Take a small bite through the vein patch. Notice how the needle here is angled to drive through the arterial wall to come out near the first stitch. It can be helpful to use your forceps so you can get a good view of the inside of the artery as you take each bite. Continue taking evenly spaced bites from inside to out on the artery and from outside to in on the vein graft. Think about your hand position and change it as needed to ensure you can come through at 90 degrees to the vessel wall every time. Also try to consistently re-grasp your needle between half and 2/3 from the tip. Remember, as you did for the patch, try to place your sutures radially as you come round the toe of the graft. Once you have come a short distance along the final side, swap over to the other needle and begin again from the heel. Focus again on careful needle placement and make sure you take a full thickness bite of the arterial wall each time. This area is particularly vulnerable to leaks. Complete the remainder of the anastomosis with this needle. Remember, in theatre, you would check inflow and back bleeding and flush out with heparinized saline before tying the final knots. You can see here the suture line is everted and the sutures are evenly spaced around the graft. As always, head to vasimulation.co.uk to leave any comments, suggestions or questions.